Hi there. Here we are with a patient that came in today for an FUE. This particular patient is from the Mideast. He went to Turkey. He had a 2500 follicular unit extraction case. He spent about 9 hours in the chair that day. Then they did not put him on Propecia or Rogaine. He ended up losing his surrounding hair. He was not happy with his hairline. He was not happy with the density, and he was most unhappy with the scarless procedure in the back of his head. He could lose this hair from where they took the holes. You can see these holes all the way up here just to get more hair. You can see sometimes when they do too close together, they get a bigger hole. So you'll see bigger holes. When this grows out, it looks very unnatural. And as you can see, all these holes now have no hair. They went super low. This is typical for what I'm seeing with the FUE because they need to spread it out in order to get the hair. And because if they take them too close, they'll get these doubles that are happening. And those doubles create holes. The FUE is not the latest, greatest procedure. It is one of the most oldest, antiquated procedures in hair transplants. It is the same thing as a hair plug. It's a punch biopsy, destroying the donor, destroying the blood supply, limiting the results, going from areas that aren't sustainable, and it is a complete loser. Mark my words. So buyer beware, and this is what we're doing daily, is correcting these procedures. We wish you the best.